An arrhythmia is defined as irregular heartbeat, actually, and it can be the heart beating too slow, too fast, or just simply irregular. But it causes a variety of symptoms. Usually the people feel palpitations, which is the awareness of the heartbeat being irregular or strong. Or more dangerously, people feel fainty, and people sometimes collapse and even die suddenly. The causes for arrhythmias are multiple, obviously, like any other condition in health. But the most common cause is damage to the heart valve, heart muscle, enlarged heart. It can also be congenital. People can be born with it, or it can also be caused by drugs or other things. There's a variety of treatment for arrhythmia nowadays. Just like most condition in health, the first line of therapy is typically drug therapy. But actually, in the past 2-3 decades, we're finding out that drug therapy, except for the mild arrhythmia, just simply does not work for the more serious ones. So the most commonly used because of higher efficacy is what we call catheter ablation. Catheter ablation is a therapy whereby small wires are inserted into the heart and map out the rhythm, the origin of the bad rhythm, and cauterize that part and eliminate the arrhythmia. Some other arrhythmias cannot be cured or medicated. These are the ones causing sudden death. So those type of arrhythmia are treated by prevention of the sudden death by implantation of the devices like defibrillators. Surgery can also be done for cardiac arrhythmias. Not common that surgery is done for the cardiac arrhythmia alone. Typically, it is coupled to other procedures, other surgical intervention, such as the replacement of heart valve, and it can then be combined with what we call maze procedure for atrial fibrillation, for instance. Other miniaturized surgical procedure using epicardial approach, the so-called mini thoracotomies, and so forth are also available. Those are also all available here at El Camino Hospital, just like from the simplest to the most complex type of ablation to device implantation. Surgery can also be done to treat cardiac arrhythmia, but because catheter ablation, meaning the non-surgical type of cure, is so advanced and so much better tolerated by the patient, surgery is rarely done as the only treatment for arrhythmia. It's usually a combination of replacing the valve, doing bypass surgery, or other type of cardiac surgery whereby the arrhythmia therapy is added on. The most common surgical therapy for arrhythmia is the maze procedure for atrial fibrillation, for instance. Other surgical procedures are also available that is less invasive, and these are called the minimally invasive surgery that is also available for the treatment of atrial fibrillation. El Camino Hospital is very strategically located. It's very advanced and has very comprehensive program for the treatment of all types of arrhythmias. Being in the Bay Area, it is also quite advanced, and in fact, it's the most technologically advanced hospital in the country, if not in the world. And for that reason, all services are just as technologically advanced, and it is very well staffed. The outcome is excellent at El Camino Hospital. The success rate for arrhythmia procedures are excellent. The success implant rate for device devices are outstanding. So it is, in my opinion, one of the best places to go to for the treatment of your arrhythmia.